What about these CT angiograms? Do they show soft plaque? So a lot of people are asking when they watch the calcium videos, they say, well, if calcium shows end-stage plaque, how can we detect soft plaque? Does a CT angiogram show you soft plaque? So here's what it is. This is the lumen of your artery. We inject dye in here. If the lumen is wide open, you're not going to see any plaque. There's not going to be anything. Soft plaque will be here in the arterial wall. If there is a section where the soft plaque is encroaching on the lumen, then it will show up. The problem is soft plaque starts in the arterial wall, and the arteries can remodel outwards a lot of times to prevent narrowing. That is kind of like a defensive mechanism that arteries have. Now, this doesn't happen in everyone, but most people, the arteries remodel outwards to try to keep the lumen open so that there's still blood flow to your brain and your heart and your other vital organs. If the soft plaque is encroaching on the lumen of the artery, the open part, this is the lumen, this is the open part. If it's encroaching on this open part, let's say it's like tight in a certain area, then a CT angiogram, where we inject dye into the lumen, will be abnormal. And I think people are not understanding that. They think that if my calcium scan is normal, my CT angiogram is normal, that means I don't have soft plaque. No, you very well could have soft plaque. You could have lots of plaque. It's just not bad enough yet to encroach on the lumen. So how do you see inside of the lumen? A lot of people say, well, then how do these studies like the PISA trial and all these other trials, how do they see past the lumen into the arterial wall? Like, how do you not see the lumen? How do you see in here? How do you see this part that everybody's complaining about? Well, they have something called IVUS, intravascular ultrasound. They have something called OCT, optical coherence tomography. We put a catheter down into the artery in here, and we take ultrasound or optical pictures of the arterial wall. Now, it's not perfect, but it's pretty good. And you actually are looking inside the wall and not inside the lumen. So if you're wondering how we can absolutely show this, this would be how. But it's invasive. You need to have a heart cath. You need to be in a cath lab. We need to go in through your arteries through your wrist or through your leg, go into your arteries. That is not benign. That is an invasive procedure where we are going into your arteries to look around and see if you have plaque.